Good afternoon. It is 5:15. With a quorum present, I will officially call the May 2020 Health System Board of Trustee meeting to order. Before we begin with tonight's business, I'm going to ask Bob Lonis if he will lead us in prayer.
Let's pray. Father, we just thank you for our health and the many blessings you give us each and every day. Father, we thank you for being our provider, our guide, and our rock. As we've gone through this recent pandemic, Father, just like you, the days of the wilderness and the Egyptians, Father, we feel like you've been with us each and every day, just giving us our daily provisions as we go along. Father, we thank you for that. Father, we also need to remember those that gave the ultimate sacrifice, giving us the freedom that we enjoy each and every day. Father, we just ask you to comfort the hearts of the families that lost loved ones while serving this country. We know your word said, Lord, that there's no greater love than to give one's life for another. And Father, we ask that you bless this board tonight, Father, as we're to make healthcare decisions that impact the community, that you've given us the opportunity and the privilege to be servants of yours in your healing ministry. We just ask that you give us the guidance and wisdom tonight as we make decisions, Father, that your will will be done, not ours. And we thank you again for all that you do, especially for giving your Son in our place on the cross. We ask in Christ's name we pray.
Amen. Thank you, Bob. I'd like to acknowledge that Russ Spray and Daryl Blaylock are calling in tonight. Welcome, guys. To protect the health, safety, and welfare in light of the COVID-19 pandemic, the public does not have access to attend in person. An audio recording of this meeting will be available to the public at www.lincolncountytennesseegov.com. That's www.lincolncountytennesseegov.com. The first agenda item is the consent agenda. Are there any items in the consent agenda that the board would like to be taken out for further discussion? If not, I entertain a motion to approve the consent agenda as submitted. Motion made.
Second.
Properly second. Any discussion? All those in favor say aye. Opposed say nay. Health system bylaws or something on that? What are we supposed to do on that?
There weren't any bylaws.
No bylaws? Okay. Quality report?
Yes, sir. I'll give a summary of the quality report, if you will. Just to let you know that we are working on our patient satisfaction. The satisfaction scores have gone down a little bit during the months of COVID-19, but just today we have re-met with our patient satisfaction work group, which includes frontline staff, to get revamped and recharged going forward. The other thing that we are doing is we resumed leader rounding. If you'll remember, we postponed leader rounding because of COVID-19 to reduce risk to employees, but we have since resumed, and so things should be looking up. Secondly, we did see an increase in readmissions in the first quarter, but I think we talked about this last month, but I'm just reminding you that we have really had an increase in acuity of patients that have come through the hospital. It's been interesting over the past 60 days, the level of sickness that has been. We even discussed that last week in our medical committee. Dr. Thomas noted that he had been taking care of some really sick patients. So obviously sicker patients means we're going to have more readmissions because patients are going home sicker than they were. Chest pain certification, we did that in February. You're already well aware of that. However, we do have new indicators that we're following, and we're getting that ramped up. One of the indicators that we'll be following will just be our door-in, door-out time. Before February, we were monitoring 30 minutes, and the chest pain accreditation surveyor told us that was just too tight of a window for this hospital and would like to see us move that out to 40 minutes. And just in the past month, we've done 3 STEMIs in the months of March and April, and 2 of those met the 40-minute mark. So that's a good goal for us, is the 40 minutes door in, door out time. We're going to be working on a Foley catheter removal program. That's really a standard of care, and we're going to get the docs involved in this and hopefully have good buy-in from the physicians so that we can really don't even put catheters in people if we can prevent them. And then, so that's going to be our big focus this summer. You know, we already been focusing on medication reconciliation, and we've done a great job with that. Quick summary of Donaldson Care Center. We are in our state survey window. However, they did a preliminary call with the state last week because of COVID-19. The CMS and the state have really reduced state surveys, and they're focusing their state surveys just on infection control. And so they did a preliminary call with the state last week. It's kind of unprecedented that that occurred. And the state was very pleased with Donaldson's plan. And so now they'll come in the building, but it'll just be focused on how did they do with preventing the spread of COVID-19 in the care center. So it should go fairly well. As you know, we've had, I'm not even going to say it. We've had no COVID-19 at the care center. We've had 3 or 4 that have been potential COVID patients, but ended up being negative. Couple of great things at the care center: falls and pressure injuries are down. And we have a new director of nursing at the care center. She started in March. She's going to be fantastic. She's already taken over the falls program there, and then we had a great month with reduction in falls. So I think just her leadership there is going to be a huge improvement. I'm sorry, Darlene Trevathan?
I don't know how to pronounce it.
I'm sorry, I don't know how to pronounce her name. Darlene. She's very experienced, and we're excited about her leadership there. And then finally, just a summary of Home Health Hospice. They are now 5 stars from their patient satisfaction. So, you know, I think last fall you charged them with improving their star ratings, and Debbie has done a lot of work to get that. They do that differently there. They break it down, quality, patient satisfaction. Anyway, the patient satisfaction piece, they're at 5 stars. So I want to give them kudos for improving their patient satisfaction. That's just a quick summary.
The next thing she needs to do is maintain it. Tell her congratulations. Okay.
Let me just give you a quick COVID-19 summary. At this hospital, we've tested 133. 127 have been negative. We've had 3 positive patients. That was back in late March, very early April, and we have 3 pending tests right now. We've really only had a couple of still continuing issues, which is we struggle with getting enough testing supplies, and then we've had some ventilator supply issues, but that seems to be working itself out now. Still going to be masking of visitors. We changed our screening process last week to reduce the congestion at the front door. It all seems to be working fine. And any questions or comments or concerns about quality?
If not, entertain a motion to accept the quality report as submitted.
So moved.
Motion made,
Second.
properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Chief of Staff report. I think we pretty much, he put that in the consent agenda where we kind of reviewed what was carried in that particular one. Next is Senior Administrative Report.
That would be me.
And let's see, the first is
That's
nursing.
me. Again, we just updated our visitation policy last week. We had had a lot of issues that I think we didn't anticipate when we don't allow visitors. And patients are more anxious, their families are more anxious. And so it was a good. We did a risk assessment of our community, and even though we have had a little bit of a surge in the community right now, we still are at very low risk in this area for COVID-19, and we felt like it was safe to increase visitation to the patients. So, and we followed suit with Huntsville Hospital. They did the same thing. So I feel very good about that, and hopefully you'll hear better things from your perspective now that patients are allowed to have a family member come with them. We did update our screening process as well because we were just having a lot of congestion at the front door during certain times of the day. And to me, congestion is a risk because you're standing closer to people. So it's going well so far. You are very well aware, but we've opened up surgeries, elective sleep studies, and outpatient diagnostics. We're continuing to ramp that back up. We've got a big week this week. We have not had any supply shortages related to those elective surgeries, and we have the director of surgery monitoring that very closely, and she reports that weekly to Courtney and I. From a regulatory standpoint, we're still waiting on CAP to come to the lab, and I don't see any other regulatory visits other than CAP happening, except for the state survey at the care center.
Are we in pretty good shape for that?
It's just going to be infection control, and again, that phone call last week where they were very pleased indicates to me that it should be a short-lived survey and it should be okay. And just to let you know, last week was hospital week, and we had a great week. We did a lot of celebrating. We ate food. We had a cookout, and the employees seemed to be thankful. And so we hope that the employees felt very appreciated by us. We tried to make it special for them.
Any questions? Okay. Next report is finance.
Chairman, the first report tab there is dashboard, key indicators, as well as profitability. I guess what I'll try to do here is just kind of summarize the takeaways. As Carrie was just discussing here in the latter parts of May, we're just starting to see the lines come back from the COVID pandemic. Basically, I think y'all probably read at other hospitals, et cetera. It was a dramatic impact on us in the month of April. If you look quickly at ER visits and outpatient visits, they're both off about 40%. Matter of fact, the hospital's outpatient revenues were off 40%. So we did feel the full brunt of it. An interesting observation would be in the inpatient arena, where as Terry also mentioned, seen a lot of sick folks through the ER. A lot of those sick folks turned into admissions, and so inpatient activity actually was pretty solid. There are 91 admissions, almost at the budget level. And so that was kind of a interesting phenomenon that took place. You look down the list there again at other activity level. VMS was off just a little bit. Again, a lot of that had to do with the folks in the nursing home not doing doctor visits. Again, as we were shutting down here in the community, some access there because it was unnecessary, et cetera. So they took a little bit of a hit. And again, the surgeries, obviously, as Sherry was saying, we had to put the electives on hold, and so those numbers were below budget as well. Overall, you don't necessarily see it there at the bottom because we did get some funding, and at that point I want to say a great thank you to both the state and federal governments who recognized the crisis that rural hospitals were in. We have razor-thin margins, and both more than stepped to the plate to assist us through this crisis, and so we're very thankful for that. And so we would have basically had, and did incur from an operational standpoint, about a $400,000 loss from a cash flow standpoint, et cetera. But because of some of the additional subsidies, we were actually able to post a profitable month. So really, that's all I kind of wanted to say about the month of April. Like I said, it was kind of what we expected. And again, though, what we didn't expect was such a great outpouring on both federal and state levels, which, again, very grateful for that.
Any
questions? Financials?
Okay. Questions? Next is...
If not, would be the next section,
Okay.
which is my section on finance. And again, this you're gonna see some, repetitive comments here as well as in the CEO section about positions. Again, we're still in the midst of changing over our physician billing system to Athena. Everything seems to be on course there. They're having weekly meetings and sometimes in between meetings to make sure that that conversion is going according to plan. I mentioned specialties. Urology started May 8th, and has already a pretty good active volume taking place in his office setting. And cardiology is to begin late June, so we'll add a needed presence there as well. And then Dr. Noble started practice. He actually started May 1st, but actually in his office on May 4th, and I know Dr. Morrison is delighted to see an additional OB provider here to give her some assistance and help. And again, the emphasis on the specialties here, again, just to repeat, is that these are fulfilling our strategic initiatives for the upcoming year. We want to grow, and we need to be able to fill that void that we currently have with other specialists to grow our surgical volumes, et cetera, to meet the needs in all these various subspecialties. And then at the bottom, I had a list for you of the assistance that we got, both from federal and state areas. And then, last but not least on that list, obviously, I think y'all probably noted it in the paper, as we did obtain the SBA PPP loan. And again, I emphasize it's a loan. And so we're in the midst of that as far as record keeping goes, and they have pretty detailed and stringent regulations as to what qualifies there for eligible expenses, et cetera. But again, very thankful that we have that cushion to fall back upon from a cash flow standpoint.
That loan is forgivable if you meet certain conditions, right?
Portion of it is, yes, sir, that's exactly correct, and that's what I meant by the detailed
Okay.
listing of the eligible expenses.
We got all the details set up to...
Yes, sir.
Okay.
Yep. That's paramount, and we'll be on top of that. And again, right now, all those funds are in a money market account, and we're treating that basically as a designated fund, not touching it. Hopefully don't need it until we get through the audit process with the federal government on that. And they will be doing an audit. They mentioned that anything over $2 million, they would do a full-blown audit on it. We welcome that. We'll be ready.
Are there any plans to use this at all?
With that.
This, the money that you got set aside? I mean, is that part of the audit when they come to see if you used it or not?
Yes, sir.
Obviously did, you had payroll.
Yeah.
Right.
Your payroll didn't change.
So they won't go any further, they just stay with the payroll? Right.
Payroll and, utilities,
Okay.
but none of that
All right.
changed.
So they don't, if they don't ask anything else, is what I'm trying to say.
Yeah.
That's what I'm trying Mr. Banker, that's what I'm
They're throwing extra rules in.
Yeah, okay.
Yeah, it's never changing.
Under their never ending target, the rules have
It's
changed.
a never-changing target, yeah. I will say this, I think, Anthony, what you're talking about is some of the other grants made are expecting us to detail out the expenses specifically related to COVID,
Okay,
whether it's additional staffing,
okay,
whether it was additional process changes, equipment,
okay.
the whole 9 yards. So it's a little different in this regard. The whole purpose of this was really to provide an economic stimulus, if you will, to local economies to keep people employed.
Okay.
Do you have a certain amount of time to use it, like the other small businesses do, like 2 months?
To use it,
Yeah, we were told we had 8 weeks to use it. Is that
Congress is trying to change it to 90, but that ain't
Right.
confirmed yet.
right. But when you say use it, it's the period covered for eligibility. Is that what you're referring to?
we were under the impression you had to use it for 8 weeks. Meaning the 8 weeks.
That's correct.
That is correct.
This is Russ.
And it's
It's
a law,
my,
they try to,
Hold on, go ahead, Russ.
it's my understanding is from the day that the loan is funded, the expenses for the next 8 weeks are what will go into the calculation for forgiveness.
There's a law that they're trying to, it's a bipartisan agreement to try to extend that to 16 weeks as well.
Right.
But it's not the same as having to actually completely use the money within that. Okay.
We're in the same school.
That's where my living
Yeah.
up there.
Yeah. Bobby, anything else?
No, that's it in the finance section.
Okay.
Next section is actually the CEO, business development.
Okay.
If
Russ?
Russ wanted to comment on that, or?
Just touch base on a few of the things that Bob had mentioned earlier. Number one is with respect to cardiology, Dr. Cox should be ramping up towards the end of June. That will give us cardiology coverage in-house and in the community 4 days per week, 2 days with St. Thomas providers, and 2 days, a Wednesday and Thursday with Dr. Cox. So that's in the works. He'll be located in our multi-specialty clinic in the office building. Urology is mentioned as well. Dr. Tapadino's beginning to spool up. That's going well. And he's in the community Thursday mornings and Friday afternoons. And we've seen the need, we anticipate a need to expand our availability of coverage in the OR to pick up some Friday cases. And so been working with the anesthesia group to do just that. So I think starting as early as this next week, we will be able to post routine cases in the OR every Friday. Still have available at that second provider as a backup in case emergencies come in. So that's something that we haven't had until this next week. Well, we had it some time ago, but we had dropped the coverage back because we didn't have the cases, and also to eliminate some costs. So that's going to be a nice addition for us as we see our overall surgical volume picking up. OB-GYN, Dr. Nobles, I believe he has 3 cases on the books tomorrow, so it's good to see him ramping up so quickly. We've tried to do a lot to market his practice to the community, just as we did with orthopedics. Had that same mailer to go out to like 18,800 mailboxes, so people in the room may have already received the mailer, but again, that went to every mailbox. And we were also, or Dr. Nobles was able to obtain a detailed list of all of his patients from his previous practice. And so a letter is going to each patient Dr. Nobles has seen while he practiced for the 6 years in Winchester. So we know there will be patients who will want to follow him to Fayetteville. I have a note about post-COVID-19 shutdown, and Terry alluded to it as well, that we are beginning to spool back up with our cases. We saw our outpatient visits drop from, well over 3,000 per month down to about 1,900. And we're even last week, just as reported by the registrars, who they register everyone that comes through the door. The comment was made to me that we've gone back to pre-COVID levels. So it's good to see the volumes returning as I'll say as quickly as they did once the governor gave us the green light to open it back up. So we're grateful for that as well. And we still have lots of work to do, and we'll always have work to do, but it's good to have work. Next, and Anthony, you had mentioned it at the start of the meeting, a warm welcome to Daryl Blaylock, who's also on the call. Daryl begins his time with us next Monday as our CEO, and as we transition to Daryl stepping into that position, he and we've got a lot of work to do. We know that's the case. We also, it's important that we not lose any momentum with regional providers or other key relationships out there in the market. So we already have meetings scheduled this next week with, and one example is we're working with David Spiller, CEO of Huntsville Hospital, our strategic partner and affiliate. And so that's in the works, as well as other key stakeholders. Already, Ashley, I know, is scheduling one-on-one meetings with Daryl and members of the medical community. So that will be time well spent. But again, we're looking forward to that. Just one personnel update. John Lavender, the administrator of Donaldson Care Center, has accepted a position with a nursing home in Winchester. We wish John well. We hate to see him go. He's been with us 9 years in the system, but this is an opportunity for him. It's 5 miles from his home. It's a smaller facility, and we wish him well. So matter of fact, our efforts are already underway to find John's replacement. So that's in the works. And I'll be glad to answer any questions you have for me.
What about the hospitalist position that you're trying to fill?
Yeah, that's we're just tracking down some leads there. I know Dr. Thomas has a prospect, and we're just working all the angles right now. But
okay.
We have that will be probably sometime around July or August 1 start. We're anticipating.
Okay. Any other questions for Russ? Well, Daryl, we look forward to you. You come in on June the 1st. That's in 2020. So we look forward
Good
to
afternoon,
you coming,
everybody. Good afternoon, everybody. Yeah, I think that's Monday, right?
Yes, sir.
Okay.
All right.
I'm looking forward to it. Yeah.
Entertain a motion to accept the senior leadership reports as submitted.
So moved.
Motion made. Properly second. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. The next item is a marketing calendar. It is there for your FYI, no action required. Next is financial operations. Bob, again, finance committee.
Yes, sir. So again, the reason I'm on there twice, this is the annual approval submission and hopeful approval of a capital budget and an operational budget for the fiscal year 2021. So I thought I would just kind of briefly hit those. These were already vetted and reviewed by the finance committee last week, and so we're bringing it to you guys to make you aware of it and let you ask questions and see if we can seek approval tonight. The first item I would say under here, trying to figure out which page number it is, about the 5th and 6th and 7th pages, the beginning of the capital budget. You see there's a lot of detail there. In a nutshell, the total expenditures that we're advocating to be spent next year for capital are $877,000. Won't go through the whole list there, but basically in summary fashion, the major dollars being allocated is obviously to the OR, as we said, to help support our strategic initiative with the surgeons. We need some equipment replacements down there. So that's there. Richard's here, so I know he'll be thankful to hear that, obviously, again, he needs another EMS vehicle, and he has sought to get a remount this year, so that's in the capital budget. We also have some radiological equipment needs, which again, another key area for us as far as the diagnostics. And I believe nursing has some monitoring equipment as well. Needs that have basically gone beyond their useful life and are difficult to find parts and whatnot. So those are our recommendations. Again, just for the benefit of some folks here that may not have been here a few years back on the board, but the budget for capital in previous years used to be closer to $1.3 million to $1.5 million. This last year, the current year we're in, we did reduce it down to about that $700,000 to $800,000 realm. We'd like to kind of keep it in that ballpark if we can. And again, just trying to watch the cash flow and the outflows, if you will. So, having said that, let me step into the very next slide presentation there, and that is the actual operating budget for next year. And I would just say to focus your attention first on the first page that kind of summarizes the 3-year comparison. And what I would say is that, again, for next year, we're projecting as a system to have a positive bottom line of $143,000. And basically the dynamics that we see taking place over the next year is the outpatient arena. Obviously, we believe we're going to get past this COVID crisis and actually be able to obtain not only that level, but then proceed to gain some growth. I mentioned OB with Dr. Nobles. Dr. Nobles, we're believing, will assist us in growing our deliveries, probably to the tune of about 20% from our current levels. And so we're excited about that. Obviously, he will also contribute to the surgical volumes. He also will contribute to the ultrasound radiological volumes. So he's going to be a key cog next year in our strategic plan. The other specialties we also mentioned, heavy OR. And down the pike, I've got actually the key indicators that go along supporting these numbers. And you'll see that we're anticipating significant growth in the outpatient surgical arena as well. The next page kind of just talks about, in general, the key drivers, if you will. Again, as I said, this is kind of like the year of resurgence after COVID-19. We're also getting a benefit of almost $500,000 of increased essential access payments from the state. That was quite the blessing we received here recently, and that should be a continuation next year as well. Again, just a reminder, I usually get a chance to talk to the county folks every so often, just remind them, but this institution now will be up to almost $2.5 million of funding from the state under essential access. And so that's important to know. It's very vital to our survival, and we're appreciative of it. We basically get that based on a formula of the folks that we treat. We treat heavy TennCare, we treat heavy uninsured, as most rural hospitals do. That's why they're so critical and important to the overall delivery of health care. The other thing we got in here is we've got a very positive Blue Cross anticipated reimbursement increase. Russ has been working with them diligently over the last several months, trying to bring that to fruition. We anticipate that in the next 30 days, probably, of getting that finalized. The other thing I kind of wanted to point out was, as you recall, the current fiscal year we're in, we made a presentation last year and said that we were going on a major cost-cutting initiative. I do want to report back that we basically did cut $2.8 million from those initiatives. It was a little painful, obviously, in some of those areas, but it was more than needed to be able to reset. And I wanted you to know that we're not stopping. This has to be a continuous program to look for opportunities to be more efficient. And so in this next year, Russ renegotiated the pharmacy management agreement with significant savings. And we anticipate with the heightened surgical volumes that we will see savings in the anesthesia subsidy arena. And, of course, we now have a controller on board, so we don't have any contract labor in the accounting labor. So that's my contribution. But anyway, so I just want to let you all know that we take it to heart. We continue to look for...
We're glad you contributed.
Thank you. And just a couple other quick notes, really, without belaboring here. The benefits, again, we've done a great job there controlling our costs on medical. Great plan restructuring last year, continues to be good. This year we've added a little bit of a tweak to it, and we're adding some co-pays to our employees to be able to drive, hopefully, some business here at their own home site for radiological services. And the other thing I just want to mention again, too, we talk about last year looking at our employee positions. Their necessity, obviously, that is the arena that all hospitals are going to now. With Russ's assistance, the orthopedic service was redone. This year we have a surgeon as well as a extender over there, a nurse practitioner, so office hours and surgical capability have been increased, and yet to the tune of a 30% savings compared to what we had previously. I mean, that to me is just phenomenal, and that's the kind of stuff we need to be looking at, making it happen. And then, of course, the hospitalist service, we mentioned last year they were looking to restructure, and we did. We brought it in-house, and by bringing it in-house and managing the billings ourselves, it's saving us almost $250,000 a year. So, again, it's a continuous process. We will continue to search, and those all add up, that and the added volumes we were talking about next year to get that bottom line. I did want to mention one more thing. I'm still trying to keep it brief, but still hit high points. There's a statement of cash flow in here, which I know county folks as well would be interested to know this. When we say $143,000 is the bottom line, there's a thing called EBITDA, which you add back depreciation and interest because they're non-cash outlays. And so that would bring us to an EBITDA of $2.15 million in the budget. Then you have to pay your debt service. Debt service next year is scheduled to be $1.24 million. And our capital expenditure budget, as I mentioned, is $877,000, leaving an increase in cash of $34,000. But that's not the key part. The key part is our debt service coverage is 1.74, and our bond covenant requirement is 1.15. So we're back on track. And I think that's key.
No special letters to be written.
No special letters. That's right. My auditors will be happy. So that's kind of a summation of it. I'm more than willing to answer any questions. Otherwise, we're looking forward to getting another fiscal year started.
So bottom line is, this is no wishful thinking. This is the bare necessities that we need, and you got detail on the volumes that you get.
Yes,
and when you look at that 11.9 of inpatients that we're talking about, do you break that out between those that are regular medical and observation? Because there's a difference in what you get back as far as insurance, isn't it?
Yes, significant difference. Again, the observation folks, they're averaging around 2. So if you backed off 2 out of that 11.9, you basically got a 10 inpatient census projected for next year.
Okay.
On inpatient.
Yeah. Okay.
Bob, in the proposed budget, is there any salary increases?
No, sir, there's not.
I just noticed as you scroll through each and every one, a little bit more for Lincoln Medical Center than was projected this year. But that could be just because of filling the places that we're at.
As far as salary expenses?
Yeah, I mean, just looking at it, like 10 million, that's gonna be 11 million on Lincoln Medical Center. Got hospital-based proposed budget, 17 million versus 16.
Well, yeah, so a good observation. Let me share this, Jack. Really, it's a little bit of a unique situation because projected 2020 has our COVID impact.
Right.
So, our staffing went down, and especially now we only had more than a handful of furloughs, but they've all been brought back. But we did ask departments to staff down, ask volunteers to take time off during COVID. Many of them wanted to for child care. So that's really...
So those numbers really just reflect the times, but
yeah.
You're telling me that
nobody
got a percentage?
There's no wage increase.
No.
No, sir. No. It basically is just due to recovering to pre-COVID staffing levels, and if we need to have any additional staffing to cover the increased bond. That's it. I believe, if I did the calc right, I believe gross revenues are increasing like 12% from this year, and I think the staff cost is up like 3% or something like that, when you look at it from an adjusted basis.
Hey, Bob, this is Russ. And the other thing I'd mention, Jack, with respect to salaries, when you're looking at hospital-based, that rolls up everything, including our practices. We did not have an OBGYN employed last year, so Dr. Nobles will be on for the full year. So we'll have had him for 2 months this time around. And the other thing, last year, our hospitalists were, for part of the year, were contracted through APP, and we brought them in-house. I believe it was September 1. And so next year we'll have 12 full months of their salaries as well. So those two will drive quite a bit of that salary differential. But when you go back and look at Lincoln Medical Center proposed budget only, the salaries and wages are pretty much tracking in line with what they are this year.
Yeah, the only concern that I have, the numbers are the numbers, it just kind of makes me think, but the only concern I have is that we don't get into a situation where the hospital gets raised, nursing homes don't,
Right.
EMS doesn't, whatever. We need to be, and I know that's somewhat driven by their own budgets, but you know, we just need to make sure that hospital getting raised, nursing home making the money.
Right.
Well, that's not going to happen. All of our adjustments, if we were to do an adjustment, it would have to be system-wide. I mean, we wouldn't look at one
And let me just say this,
business unit.
I have full confidence in our leadership group. I hadn't always had that, but I do now.
Thank you.
Any other questions for Bob?
I've got a question. With our increased cardiology coverage, will that open the door for us to rehab cardiology?
It could.
And Mr. Ogle, this is Russ. It certainly would. We will need to find the space where we can do the rehab. The cardiac rehab's a bit unique in that it must be provided in a space where you have immediate access to a physician. So we cannot establish cardiac rehab at the Patrick Rehab Wellness Center because there's not a doctor in-house. So we will have to find a place under roof in the hospital. And so that's the challenge for us there. The only space that we have that comes to mind, honestly, is what used to be the radiology file room. But that's our challenge. It would be a great service to have locally because we know people are having to travel currently.
Thank you.
Any other questions? If not, entertain a motion to approve the capital budget as well as the FY 2021 budget. Oh, that's included in the FY 21. Are they?
Well, they're two separate,
Okay.
capital and operational.
Entertain a motion to approve the capital budget for fiscal year 2021.
So moved.
Motion made, properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Entertain a motion to approve the cost-effective, reasonable FY 2021 budget tonight.
Move for.
Motion made, properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Next agenda item are informational copies from HR with 2 dashboards that they provided, and that will be an FYI. John Lavender submitted his monthly reports. Are there any questions about that? If not, I entertain a motion to accept the report.
I got one question.
Okay.
I noticed on his report, hopefully as Kerry reported earlier, their safety and quality, you know, they pretty much quit meeting because of COVID, but have they started back as well, or do you know?
They had what meeting last Friday?
We had a meeting Friday.
So it's back on
It was a
Monday.
great meeting.
Yep, okay.
Yeah.
I felt like this was.
Okay. Entertain a motion to accept the Donaldson Care Report as submitted.
So moved.
Motion made and properly second. Any discussion?
Just one question. Are we still having issues with our Wonder Guard?
That was on the report here. They did-
Well, I know,
Yeah.
but I didn't know if they had any radio issues still, or we got all that fixed.
As far as I'm aware, I'll report back to you next month. But as far
Same
as
here.
I'm aware.
I'm not aware of anything.
Okay. If you can, when you find that out, just send a note out to all of us on that through email.
And I was just curious if the vendor fixed that, or if we had to pay to fix that.
Okay, I'll find out.
Okay.
You know the answer to that.
Yeah.
Yeah, I do. I just want it in writing.
Next is the rehab report. Are there any questions on the rehab report? If not, I entertain a motion to accept the rehab report as submitted.
So moved.
Motion made,
Second.
properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Next is EMS, and we're honored to have the leader of that group, and I think he wants to briefly tell us what's going on. So, we'll turn it over to you, buddy. Mr. Wright?
Thank you, Mr. Chairman, for allowing me to speak about it. In the month of April, we were down a little bit volume-wise. Bob had mentioned that, Gary also, but as far as the acuity of patients, our acuity was very high in our transport, transfers out. That made up a lot of difference on the ALS, BLS versus BLS charges. Our charges were very high in April due to patient acuity. Due to the elective procedures not running during that month, we were also down a little bit from that. We're back on track now with our elective procedures. Our BLS truck has been very active, doing several transports, and this is a big help to our service in growing the service volume-wise, and it's a service line that we hadn't always offered, and our community really appreciates this, transporting people back home to the residents, transporting them to doctor's visits, wound care, and various types of transports like that we're dependent upon services coming in from other counties to do these transports. So we're now able to do this, and also it helps offset some of the cost of operation. Most of these charges are approved by insurance before the transport is ever made, so we know we're going to get payment on them. Also, we've been working with our rev cycle and our billing company on some of the other transports. Our billing is outsourced, so we're trying to capture every bit of revenue that we possibly can inside this. Our BLS truck is staffed from 8 a.m. to 4 p.m. in the afternoon. They usually average around 8 to 10 transports daily, and it all depends on if these are local transports or they're transporting out of town. But it's been a great help, great addition to the operation. Our staffing is back up now to full staff. We had, in the month of February and March, we had 3 full-time personnel that was out due to FMLA, and had one out with a back injury on working comp. But all of our staff are back now, and we were able to staff most of those vacancies with PRN staff. We were able to increase our PRN pool, and that's been a great addition to keeping our overtime down, and that seems to still be trending down using our PRN staff whenever necessary to fill in vacancies, keep down the overtime. A report on our vehicles: we have 6 ambulances, and we have 4 units at this time that are over 100,000 miles, and we have 200. Thank y'all very much for considering and passing the remount. We've got one that we're going to be remounting. That unit currently is a diesel model with 343,000 miles today. So it's greatly needs to be replaced. And I spoke with the vendor. We're going to probably have a little bit of difficulty getting the chassis to do the remount on. Currently we're running Ford. There is an option for Chevrolet, but he does think that probably the same situation will apply. But we'll take whatever chassis we can get. But the Ford that we're currently running they have been wonderful. We hadn't had any problems at all with those trucks. Just minor repairs, oil changes, things like that, nothing major at all. And the highest mileage unit we have now is 178,000. Still running daily, no problem. Last week, EMS celebrated EMS week. We have a gentleman on staff that's real handy with a smoker. He smoked Boston butts for all three crew members, all three crews, all three shifts. And also coming off the hospital week, the crew, I got to participate in hospital week 1 week and EMS week the next week. They looked at pretty good. They were very happy and very thankful for both. But we're very thankful for the crews we have. We have some very dedicated people that's doing a great job. And during this pandemic, the guys have stepped up and they've provided very good service to the community and at a very high level, which they do every day. And very thankful to work with such a good group of people. Now, we're happy to answer any questions you might have.
Any questions for Mr. Wright? I'd like to compliment you and your crew for the way you've turned things around, and I know the BLS was part of the Get Well plan.
Yes.
Our fees were another part, but what you can't measure is the attitude and the work ethics that people have. And all those things together, by next month, I think you're going to have break even. I think you're right under, maybe a little less, about 12,000 under, but hopefully next month we'll be right on target. So appreciate the effort that you and your crew have done. In fact, appreciate the effort this entire health system has done, in particular in response to this pandemic that we've had. You couldn't ask for better people to step up and answer whatever needs to be answered. And you could just see that it seems like it's a better, people are walking lighter and people appear to be happier. So we thank you all for what you do. And Russ, we thank you too, buddy. You had a big say in all this, and we appreciate you as well. I know you don't like
Thanks,
to be
Anthony.
bragged on, but we just did it. Yeah.
That's quite okay. And hey, Richard, you and I are going to need to talk about those Boston butts. I don't think I tasted the first one.
Trouble.
Well, as I say, we got a good smoker on staff, so we can take care of it.
Okay. Entertain a motion to accept the EMS report as submitted. Motion made.
Second.
Properly second. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. We got any new business to discuss? We got any other business to discuss? Do we have capital expenditures tonight? No capital expenditures? We have a couple of personnel matters to discuss in executive session, so let's take a 2 or 3 minute break and go from regular meeting to executive session. All right, we're now in regular session, and we discussed 2 items, 2 of which will require action, and 1, I need a motion regarding the old home health building.
I'll make a motion to get a bid or appraisal on the Wilson Parkway on that building.
Okay, motion has been made.
Second.
Properly second. Any discussion?
One thing, is that Cole and them will get those bids for the appraisal?
Yeah.
Right, not us, so it makes
I
sense.
think we have to have finance.
Okay, all those in favor say aye.
Aye.
Opposed, say nay. The second action item is to utilize a headhunter firm to assist in staffing the nursing home administrator, with the understanding that if they do not place them, we owe no money. So entertain a motion to approve utilizing. Okay, motion made by Dr. Edwards, second by Donnie. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Any other matters brought before the board? If not, I entertain a motion to adjourn.
So moved.
Motion made, properly second. All those in favor say aye.
Aye.
Opposed, say nay. All right.